Welcome, everybody. My name is Brian Zikmund-Fisher. I wear many, many hats, among them as editor-in-chief of SMDM's journals, MDM Medical Decision Making and MDM Policy and Practice. Um, I'm also, I have done the SMDM abstract review for the conference, I think every year since I joined SMDM, which is now over 25 years. So I don't know how many rounds of abstracts I've done through that. Um, and I think a lot and teach about science communication and have a lot of thoughts about what it takes to present science in clear ways for different kinds of audiences. And so, as we have been talking about supporting our annual meeting coming up next June, July in Oslo, with the abstract submissions due in January, I volunteered to say, to hold this session to talk about what do we look for? What should we be looking for when we're reviewing an abstract for SMDM's annual meeting? How is that different from maybe abstracts that we write for other purposes, for journals, for grant proposals, et cetera? And what are some broad principles that I am always looking for as a reviewer and that I'm always thinking about as an author, trying to ensure that my abstract is getting my message across to the audiences that I want it to get across to? So I've got a moderate set of slides that I'm going to go through to start. But please hold on to, feel free to drop stuff in the chat. We're going to definitely have time at the end for questions. And this is really a commentary. It's not that there is a single right answer. Every abstract must do X in order to be a good one. Quite the contrary. But I do think that there are some broad principles about abstract design that we can leverage to make our own abstracts more persuasive, more likely to be selected, and certainly that we should be constantly thinking about when we are acting as reviewers and making decisions and ratings of other people's scientific abstracts as part of the meeting planning. So let me just move forward. And I want to start by acknowledging something that I've talked about a little bit already, which is the idea that there is not one kind of abstract, but many. And in particular, I want to draw this distinction between what we do when we're writing abstracts for our papers, for journals, versus what we do when we're writing abstracts to submit something to a conference for a presentation. You know, paper abstracts, if you stop and think about it, really the paper abstract is written for the reader. It's the summary of all the things that are included in the paper. And the people who are most likely to be reading the abstract are not just people who will read your paper, but people who are deciding whether or not to read your paper, right? It's used primarily to help people find papers in the index databases because it's the abstract that goes into those databases. And all the keyword searching uses the abstract to find papers that align with particular topics. What that means, of course, is that the paper abstract has to include the relevant search terms or keywords, something that somebody would be searching for in order to figure out whether this paper is something that they want. And that might be topical, and it might be population, and it might be methodological, and it might be measures, and it might be findings. But whatever it is, that's what has to be there in order for the abstract to do what it needs to do, i.e., to make somebody want to read that paper. As a result, it's also got to be, at least to some degree, complete in the sense it needs to touch upon all of the primary and sometimes some of the secondary findings of whatever the paper is, so that it's a complete representation of all the things that are there that somebody might want to be learning about if they go to read the paper. In other words, it summarizes the total impact of the paper, of whatever is included in that scientific record. But when we're doing abstracts for SMDM or other scientific conferences, we're actually doing a very different task. We're writing for reviewers, right? The reviewers, the only people who really read presentation abstracts are the reviewers. You're more likely to get more people actually in your presentation or at your poster than will ever read the abstract. And so we should be writing abstracts for what the reviewer wants to know. Well, what do they want to know? They want to know, is this something that I want to select? So it's a comparative evaluation thing. You need to be selling the comparative value of your work because it's going to be compared against others' work. What that means is you also need to be highlighting who's going to be interested in this, right? What do reviewers do? They evaluate paper, they evaluate abstracts for consideration for presentation, and they use that abstract to perhaps group papers or figure out which things should be put together in a session, etc. What that also means, though, is that a presentation abstract is smaller in scope often than a paper is. It's about a singular research question. You're going to pose a question. I'm going to keep coming back to this idea. You're going to pose a question, then you're going to answer it. It doesn't necessarily cover everything that is involved in that paper, or even certainly everything that might be involved in that project. And that's a key idea here. It's not necessarily complete. It's covering the things that are relevant to the specific thing, the specific question or issue you want to be highlighting in your presentation. And so with this as a background, let's get into the aspects of a presentation abstract. What should we be looking for as reviewers? What should we be including as authors? And number one idea here is one research question. One, not two, not three, one. You've got 10 minutes at SMDM if you've got an oral presentation, and you probably have less than 10 minutes if somebody's stopping by your poster. You're going to get one thing across, only one thing. So the point here is, what are you trying to get across? What is that one research question that you want to highlight in your abstract? Your paper may cover many different things, but your presentation isn't going to cover all that. It's going to focus on one thing. So think of a presentation abstract kind of as a story. A good presentation abstract is going to set up the story with giving us a little bit of background, not everything, just what we know already that's relevant to some particular problem or tension, something that we don't yet know. And then you're going to show in the context of your presentation the answer to that question, the solution, and potentially its implications. Notice that this means that you're emphasizing anything that's relevant to that core problem and solution, not a complete representation of what you did. So there may be aspects of the research design that would have to be in a paper abstract that are excluded from a presentation abstract because they're not central to the story you're telling for this particular presentation. And just sort of re-emphasizing this idea, think about bracketing your abstract, right? What I'm going to argue today is that the most important parts of the abstract are the background and the conclusions, not the methods, not the results. What's the question you're going to pose? What is this presentation going to be about? What's not currently known that this study now is going to answer for the audience? And then by the end, answer it, at least to some degree. Don't go into other things. Don't go into the broad overviews of everything your project is about. Answer this question and what is its implications? Now, as you're thinking as a reviewer, here are some key questions that relate to that. So one, if somebody's done a good job and defined a specific research question, we as a reviewer should be asking, how important is this question? Is this a really earth-shatteringly important question, or is this a relatively minor question? Either that's fine, but it's a question that we need to be considering as a reviewer in terms of how we're going to rate that abstract. And we should be considering, to whom does it matter? Is this a question of broad interest, or is this a question of narrow interest, where a certain group of people might have a lot of interest in it, but the rest of the conference attendees might not be that interested in it? Again, not that that's an evaluation. There's important need for science that does look at very specific questions, but we as reviewers should be thinking about that. Second, obviously, we're looking at strengths. What is good about this study? What are its particular strengths? And in particular, what have the authors highlighted? Because sometimes the point of a presentation is to highlight a particular aspect. We did this study and it's the biggest data set ever tested on, that we've done on this, or this is the first time we're going to be using this particular model type, or whatever. What is novel? What is the thing that needs to be brought to the surface that sells this particular presentation as something that you might be interested in? And of course, on the flip side, what are the study's weaknesses? What are the things that in this presentation going to have to anticipate and address? Now, an abstract is just that. It's an abstract. It's not covering everything, but you, as a reviewer, should be thinking about, that seems like whatever are the weaknesses of this study, there's are things that ideally the abstract is at least acknowledging, and certainly ultimately will need to be acknowledged in whatever the presentation is. But my last point here is also the critical one to think of as a reviewer. What's missing? What's unknown or unstated in this abstract that you as a reader, as a reviewer, are going like, well, wait a second, where are these data drawn from? Or, how did you control for this source of variability? Whatever. Um, if those kinds of things pop up in your mind as a reviewer, that's a critical piece that needs to be brought into your evaluation, because it means that there's an element of the science that is relevant to you that isn't being talked about. And it's, of course, finding that balance between being complete enough to address these things that reviewers are looking for and not being just a data dump, but instead telling a story. That's the heart of making a good presentation abstract. So let me try and walk you through what I think should be done in different parts of presentation abstracts to try and accomplish this balance. First, let's talk about the title. In journals, there are sometimes rules. Like some journals are very explicit about you shouldn't give the answer in your title, and these very sort of limited structures. And that's understandable. When we use titles to sort of represent this is what this paper is going to be about, there's a need for relatively descriptive titles. But when we're giving titles to presentations, you're trying to sell yourself. You're trying to sell this idea. So as a reviewer, I like seeing titles that I think are actually informing me, making me curious, making me want to be knowing more about this. Now, obviously, it needs to clarify the domain. What are we talking about? But in particular, I think a title should allude to the larger question. What is this presentation going to be talking about, and why would I be interested in it? So what's the question here? And or what are the results that I'm going to hopefully learn if I go to this presentation? Now, introduction. I've seen presentation abstracts that have huge, big paragraphs of background, and I've seen ones that have one sentence. And honestly, the ones that have one sentence are sometimes better than the ones that have bigger backgrounds. If you don't need it, it shouldn't be there, right? The main thing that needs to be there is, what is the research question? What is this presentation now going to tell me about? And anything else is just there to set up that question. And if you can get rid of that background, remember, you're talking now to reviewers. These are experts. These are people who presumably have some knowledge about this topic domain. You don't need to start at first principles. You can often start fairly far down the pathway towards your research question, knowing and trusting that the reviewers will have some background that you can rely upon. Now, when we get into methods, there are, of course, huge, varying different types of methods, not just in science in general, but even within SMDM. I mean, we've got everything from microsimulation models to cost effectiveness analyses to discrete choice experiments to survey experiments to qualitative interview studies. So I'm not going to try and dive into what should you have in your methods for each of these particular methods. But notice my emphasis here is on key facts, not completeness. What are the key facts that a reviewer needs to know in order to evaluate the quality of your work? So I do a lot of survey work, which means a big part of the question in surveys is, what's the sample? How big is it? Who are they? Is this representative or not? Like the data quality issues. Data quality is going to be a different kind of thing for different kinds of studies. That's fine. But that's going to be a really critical question. Like, is this okay, that's kind of interesting data, or is this, wow, that's a really interesting, large, powerful data set, et cetera. Same thing when we're talking about building models or analytical plans. Like, you're not just describing everything. You're highlighting what is the element for this work that would make somebody interested in it. And notice that I'm putting a bullet here that says this may include things that you typically put at the start of a results section. So for example, in surveys, it's not uncommon to have the data characteristics and the demographic characteristics of your sample in your results section. But for a presentation abstract, put that in methods. Get it out of the way, because the methods should be everything that somebody needs to think about to evaluate, is this a work that I'm going to think of as credible, trustworthy, interesting, etc. And so, this could include lots of different things about data: size, type, its qualities, the demographics of the sample, or where it was drawn from, its representativeness, etc. Like if you're talking about a national registry data set, I need to know that, because that's really different than talking about some sort of sampling process from one particular medical system or something like that. Um, It may also include the primary outcomes, although again here, completeness is not required. There are times in which you're not going to talk about measurements. You're going to save that and you're going to talk about it in your results, because you're just saving space. Um, Methods here is a selection process. You're intentionally pulling out the pieces of your methods that are most relevant to the reviewer. And that's going to be different for different studies, but you should be thinking intentionally. This is not just a data dump. Now, when we hit results, we tend in papers to have those introductory table ones, a couple paragraphs, etc. For a presentation abstract, you get right to the point. Put your most important finding in your first sentence. Then go to your next point, etc. You're not going to cover everything. You're certainly not going to dive into secondary analyses, etc. Presumably, if you've defined a good research question, you're starting to answer that question right away. And so, again, emphasizing what's novel here, what's surprising, what's critical, what are the interesting pieces of the results that will capture somebody's interest. Now, when I talk to people about presentation abstracts, they ask me, well, okay, how much, do I need to put p-values in? Do I need to be putting means or other kinds of statistics in? I don't think there's a single answer to that. I will tell you the way I think about it. If there's a singular one or two pieces of quantitative data that are emblematic of the finding, right? They are the demonstration of the effect size. They're the demonstration of just how significant whatever this effect is that you found is, etc. Then fine, include those, because they're the most powerful evidence for the point that you're trying to make. But it's also okay, especially in a presentation abstract, to be more listing of things. So I've seen abstracts that say, we found significant effects for X and Y and Z without listing p-values or betas or odds ratios, etc. You're going to see that when you get to the presentation, but it doesn't need to be in the abstract. I'm going to trust you as a reviewer. I'm going to trust you to say, you're telling me this is significant. You're telling me these are the important findings. Okay, now I'm interested. Now I might want to see this presentation. Again, this is about storytelling. You're not being complete. You're pulling out the specific pieces of your results that are answering the question that you're posing. And you're doing so in a way in essentially the way you would do it in a conversation. Like in a conversation, we don't take a long time to get to the answer. We say to me, well, was there an age effect? And we say, oh, yes, there was an age effect. There was a huge age effect, blah, 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 blah. And we go off and we put our most important points right from the start. And so have that mindset, that sort of conversational mindset, as you're writing the results section of a presentation abstract. And then we get to the conclusions. And honestly, in many ways, the conclusions is the most important part of a presentation abstract. And this first bullet, I think, is the key thing here. Your first sentence is not a restatement of what you did, is not a restatement of the design. It is the conclusion. What did you find? Again, thinking that inverted triangle structure, bring your answer right from the start. And ideally, you're closing the loop. Like you posed a question in the background, and the last sentence of your background was that question. And then if you leap forward to the conclusion, we should be getting in the first sentence of the conclusion the answer to the question that you posed at the beginning. And what I love is that when conclusions name that, sometimes just the primary conclusion, and then move forward into the implications of that conclusion. Again, you don't have to list all the things that were found, but why do I care about this? What does this mean? Ideally, we want to be avoiding sort of the vague general statements of, more research is needed. Yeah, more research is always needed. What do we learn from this specific finding? And by the way, not whatever else was done in that project. Anything in a presentation abstract conclusion should be related to whatever you are talking about in this specific presentation and nothing else. So now I'm going to touch upon a few examples. These are shamelessly swiped from the abstracts that were published from an SMDM meeting a couple years ago. I am not trying to call out particular people's research. And in fact, you'll notice that I am going to completely omit the methods and results sections. I'm just going to focus on the background and the conclusions, because I think you'll see what I'm trying to get across here is you set the arc for your abstract at the beginning and the end. And then in the middle, all you have to do is just to fill in the blanks. So I'm going to show you a set of these. On the left-hand side, you're going to see the purpose, the background section. And on the right-hand side, you're going to see the conclusion section. And what I'm also going to do here is I'm going to color code. So I'm going to color code in a sort of red tone statements that are highlighting problems or issues. What was the thing that motivated this research? And then in blue, I'm going to highlight the research question and the research answer. So matching that question and answer idea. So we'll start here. Decision makers and clinicians increasingly seek clinical risk prediction tools that are race neutral, do not include race as a predictor. However, notice there's that but, that what's wrong? We don't know. Omitting race from these tools could lead to inaccurate risk predictions for minoritized racial groups. Microsimulation models offer a way to understand health disparity consequences of omitting race. Yet, again, another tension. They often rely upon data that itself contains racial bias, introducing racial bias into the evaluation. So now, question. Using microsimulation, this study assessed the impact of omitting race from a colon cancer decision tool on health outcomes, etc. Notice, it's not framed as a question. Like, we don't see a question mark here, but assess the impact. What is the impact? We don't know. That's what this abstract is going to tell us. What is the impact of omitting race from a colon cancer decision tool? And what happens? Conclusion. Omitting race from a clinical decision tool that guides colon cancer chemotherapy could harm disadvantaged group and worsen health disparities. See that matching? See how we go from the question that's posed at the end of the purpose right to the conclusion. And there's more details of there presented in the conclusion. And we could dive into what those particular methods were, but you can see the arc of the story even without the methods and results sections. Now let me show you another one. As FDA-approved AI for medical imaging rises, radiologists are increasingly using AI in their practices, right? This is background. For example, in lung cancer screening, diagnostic medical AI offers a second set of eyes with the potential to catch cancer earlier than human radiologists. And then we get to this tension. As radiologists consider adopting diagnostic AI, however, it becomes increasingly important to understand how agreement or disagreement between AI-derived recommendations and human radiologist recommendations affects patients' trust. Now, I've coded this as red because it's highlighting the tension, what's not known, but it's also really the question. What does happen if there's disagreement? And does it affect patients' trust? Those are the core questions that are now being posed here. And you get to the end, patients may not trust radiologists who undercall AI. That's a conclusion, right? That's not the broad set of all the things that might happen. That is the conclusion from the study. And there's maybe further detail. Maybe there could be more in terms of the conclusion. Again, we all know that there's word counts on these abstracts. You can't get everything in that you might want. But we see that mapping from question at the start to conclusion at the end. Here's another one. Calibration plays a critical role in health economics decision models by aligning model outputs with real-world data, ensuring the validity and reliability of model outputs. Great, this is background. Calibration is important, right? Okay, but calibration target data, however, are often imperfect, exhibiting issues such as noise, imprecision, outdatedness, and bias. There's a problem. There's a tension. So what are we going to do about that? Well, this study aims to present a novel method for quantifying the value of information associated with removing the uncertainty in calibration target data through expected value of partial perfect information, et cetera, et cetera. Right. So this study aims to address the problem it has just identified in the purpose. And then we go to the end. The proposed method provides a computationally efficient and accurate approach, enabling better informed resource allocation decision. And it continues with that theme. So again, names a problem. It says, we're going to try and solve this problem. And then at the end, it says, hey, we've solved the problem. Look at us. But that linkage between the purpose and the conclusion is the critical piece here. One last one. Including adolescents with disabilities and shared decision-making about their mobility healthcare may facilitate developing skills for transitioning to adult healthcare, right? This is background. It might. However, due to the complexity and diversity in decisions and healthcare needs, adolescents and young adults with cerebral palsy may have limited experience participating in decision-making. So we've got a problem. They've got limited experience. What are we going to do about that? The purpose of this work is to understand the barriers and facilitators to decision-making. What are the problems and what might we do to facilitate decision-making about mobility healthcare from the perspective of these patients and their caregivers? Okay, so now I should be learning something about barriers and facilitators, right? Now, the second sentence here does this. Open communication, sharing information about options, et cetera, all facilitated involvement, autonomy, and independence in decision-making. But I would take that first sentence out. There is no need for that first sentence. It doesn't tell me anything I didn't already know. We can go directly to the conclusion, which is the listing of the things that are facilitators. So let me close with a few things that I think abstract reviewers should always be thinking about. First, I've said it over and over again, is there a single clear research question? And does it then answer that question? Just simply saying we did this and then we did this and then we did this is not actually a presentation. There should be a question pulled out from that project that motivates it, and then a clear takeaway answer. I already talked about this. In evaluating an abstract, good science comes in big pieces and small pieces, but from a reviewer standpoint, we should know which is which. So is it of broad interest? Is this going to be transformative to a large population of researchers or policymakers? Or is this something of more narrow interest? We should be asking that of every abstract that we review. Is all of the relevant methodological information available in this abstract? If you've got something, oh, wait a second, my evaluation of this is going to be really dependent upon this piece of information that isn't there, you're going to need to, maybe review that abstract to be less good because it's incomplete in a way that was critical for your consideration. Again, not incomplete in terms of it didn't include everything, but incomplete in a way that was fundamentally affecting your ability to evaluate the quality and significance of the work. That, of course, is the big question here. How strong is this evidence? How strong is this finding? Do you trust it? And honestly, that's what I'm doing when I review abstracts. There's a lot of things I'm like, okay, that's interesting, but I have questions. So maybe I'm going to be more likely to say that's a reasonable poster presentation abstract. I'll rate it moderately. The ones that I'm going to recommend for oral presentation, those are the ones I'm like, wow, I trust this. I believe this. And whatever it is that's about that piece of science, that led me to that, that's what I'm going to hold on to when I make that recommendation. And I'll end with this. Why does the audience care about this? There are lots of pieces of research, unfortunately, that get done just simply because nobody's ever done it yet. And that's not actually a reason to do a presentation. So if we're acting as reviewers, if we are the gatekeepers trying to bring the most powerfully important research to our SMDM meetings, we need to ask the question, why will the audience care about this? Now, if you've done a good job as an author, that should be transparently obvious. You've posed an important question. You've shown important implications, and you've presented evidence that your work is of high quality, that you've got good data, good methods, good analysis plans, etc. Any and or all of those reasons might be why the audience will care. Right? There are good abstracts that are purely about, we've got a really new, novel, important methodology. Fine. There are times in which it's about the data. Nobody's ever had data like this. Let's see what it tells us. Great. Sometimes it's about the question. This is a super important question. And even though the data aren't perfect and even though the answer isn't clean, we need to see this. Fine. But you as a reviewer should have an answer for this question. And that should inform what rating you're going to give to an abstract. All right. So I think that's it for my slides. Let me close that off now and really just throw this open to people. Like, put stuff in the chat. Are there questions that you'd like me to pose, and types of abstracts that you've seen or that you're trying to write that you're like, what would he think about this? I'd love to try and respond to it. But more broadly, I want to take us back to where I started, which is to remember that when you're acting as an abstract reviewer, um, you're doing a different task than you do as a journal reviewer or editor, right? You're really asking the question, why should I care about this? Why is this interesting? And a good abstract answers that question for you. Like, it sets up a problem, it poses a clear question, it gives you reasons to believe that it's going to answer that question well, and then it gives you an answer that hopefully at that point you have some degree of confidence in. And ideally then takes you someplace and says, and you're going to want to pay attention to this because it has some important implications down the road. So anyway, let me wrap up there, and encourage you to drop stuff into the chat and we'll go forward from there. I think that will be easier given how many people are, there's like 58 people here. So I think it'll get crazy if people start unmuting by themselves. But I'm happy to, if you could drop stuff in the chat, I will then sort of moderate and respond to stuff and maybe ask you to unmute if there's a clarification that's needed. Or maybe I've just shocked you all into silence because you can't figure out what to do next.
There's a question in the chat, Brian, from Elena.
Oh, I hear this. Thank you. Is the abstract review process using a rubric with key takeaways you just presented to align criteria reviewers focus on? I'm sorry, I'm hard to process this.
I'm happy to unmute if you want me to
Yeah,
clarify
can
the
you explain
question.
that? I'm trying to, there's lots of good words there, but I'm not sure I'm processing exactly what the question is.
Oh, sorry. So my question is like, I think you presented really great takeaways, like as you just presented with the examples, like, is there a proper question? Is the conclusion answering that question? So I was wondering, like this, like selective people in this group now focus on that, but I was wondering, is there a rubric, like the reviewers that sign up, like, do they get like questions like what you just presented, like your key takeaways, also to align kind of the way we value what is a good abstract and whatnot?
I am trying to remember what is actually in the form. There's not, if I remember, that much in the form. There is a rating scale that basically calibrates you towards sort of like 8 or higher. You're recommending for oral presentations, like 5, 6 is poster. I forget where the exact cut points are, but like middle of the scale is this is probably fine for a poster. Lower numbers is major methodological concerns, probably may not be acceptable, etc. Part of the reason why I don't recommend sort of checkbox style criteria for reviewing anything, but certainly for presentation abstracts, is the heterogeneity. Like, what would make me want to go to a presentation can be very different for very different types of things. Like, I remember certain abstracts that I reviewed where the data were just so novel. I mean, it had weaknesses. There were problems. Like I knew it wasn't generalizable, et cetera, but it was like the first window into some questions that we'd never had an opportunity to learn more about before. And that made it interesting. And that made me want to recommend it for an oral presentation, despite its weaknesses. In other contexts, it may be, wow, this is just a really, really good example of something. Like, and it's so clean and so methodologically sound. I'm like, great, I'm going to recommend that. But on the other hand, if I look at that and I go, that's a really, really great example of a thing that's a really, really small finding, I'd be more than happy to recommend it for a poster, but I might not be motivated enough to rate it high enough that I'd say I'm going to recommend it for an oral presentation, just simply because of its narrow scope. And that's fine.
Brian, can I add one more thing to the
Yeah,
numerical scores? I believe this is still the process, but correct me if I'm wrong, anybody in the Zoom who knows better. We do end up then using a Z-score based system per reviewer, which means if you gave everybody a 9
yeah,
as a reviewer, you're actually giving everybody a 0 on a Z-score. If you gave everybody a 5, you're actually giving everybody a 0 normalized score.
right.
If you gave a bunch of abstracts a 5 and then one a 9, that 9 is standing out on the Z-score is very high. So if you want to kind of think about this Z-scoring system, if you think this way, to really highlight abstracts that stand out from your in your batch that you think should be elevated, think about it how it relates to the other scores you're providing. Or alternatively, if there's one that you really don't think should be in, you could kind of go the other, give everybody a 7 and one a 3, and that 3 is going to stand out more than if you give everybody a 3, just kind of statistically.
Let me respond to this question here about, can you write an abstract with preliminary findings and how are those rated? Different conferences respond differently to this. And let me speak from my perspective about SMDM, but I'm not representing SMDM in any official capacity when I say this. We expect data. You cannot write I'm going to collect these data kind of abstract. Like, that's a hard line. You must have your data. Now, you may or may not have completed all the analyses you may do with those data. And it's certainly not uncommon for people to write abstracts with one set of analyses. And as the analysis progresses, they discover new things and the story changes and the ultimate presentation reflects the final science, the final answer to that story. And that is fine. But I think for us, the line is, you have to have the thing done. Like, you have to have the data, you have to have the model, et cetera. You have to have your work completed, at least in that data collection standpoint, before you write your abstract. How much you relate things lower with preliminary stuff. Again, what does it mean to be preliminary? Like, when we're talking about answering questions, again, it's not about the completeness of your analyses. So let's say again, I know survey data really cleanly, so I'll use that as an example. I might have done my primary analyses with the main effects of whatever it is I was looking at, but I haven't done secondary analyses. I haven't looked at detailed interaction effects, et cetera. Fine. Your abstract is then going to focus on what you've done, and it's going to be rated on how important based upon what you've done. And if the preliminary data, those main effects are huge, you might get rated very highly just purely on that. If you uncover later on some secondary finding that you're going to really highlight later on, okay, but that wasn't there when we were evaluating it. I'm looking at now Yulia's question.
Brian, can
Yeah,
I jump in just to clarify?
please.
Because there was a direct question about the review process this year. So for those who don't know, I'm Darren Zaranek, also at U of M. I'm one of the two scientific review co-chairs, so I'll be responsible for taking the scores and trying to slot them into a nice set of presentations. So to more directly answer that first question, no, this rubric, there is not a rubric given to reviewers that follows this. And Brian, I think you would agree that this talk is kind of your recommendations for best practice, but not necessarily the way that everybody writes an abstract, nor will every reviewer follow this. And there's a lot of reasons for that. One, we're scrambling just to get enough reviewers that it is, and then to expect people to go through training and follow. It's just not practical. But I would echo, Brian, that you've kind of encapsulated a lot of things that I've kind of learned intuitively over the years. And I think if people follow your advice when writing their abstracts, they will do better than if they don't on
Yeah.
average. Yeah.
And I also go ahead, Darren.
No, you go ahead. Go ahead. That's fine.
I was just going to say it also reflects the heterogeneity of the types of abstracts that we see. Like what you need to be paying attention to on a qualitative interview study and what you need to be paying attention to in a microsimulation model are different things. But the common element is this larger question of, okay, for the people you're trying to reach, reviewers who are in your area domain, who have background here, what are they going to care about? Why will they think this is interesting, et cetera?
And just to follow up on
Yeah.
Anchor's point, if I can, Brian, please. So
Yep.
you are correct that we do use z-scores, so your interpretation is 100% correct. The corollary to that is we need lots of reviewers. So everybody listening to, because that averages out the z-scores for everybody. And so anybody listening to this, I hope you now consider yourself qualified to volunteer to review if you have not already. And then my other request for anybody who does agree to review, even a brief sentence, there's an open box for comments on, to justifying your rating. This is an early study, but it's a really important area of broad interest. Or
Yeah.
this is nice preliminary work, maybe more narrow focus to this group. That will really help us because we're going to have all these scores and then have to try to put them together in meaningful, interesting groups of presentations. And those comments are incredibly helpful when we do that. So, I mean, just a nice job or bad abstract, that's not helpful, but just a little bit of information to justify why you gave that score, either high or low, will really help us when we're slotting abstracts.
Yeah. I've got a few questions here I do want to try and answer directly. What's the best way to evaluate or present a systematic review abstract? Should it focus beyond novelty of the research question or on the findings? Could be either. My answer to you is, what's novel about this systematic review? Is this a situation in which there is no past review and just aggregating the data that exists is the primary contribution? Or is there something that's coming out of that review that is fundamentally interesting? And so the real takeaway for the audience is going to be not the fact that the review has been done, but what it found. Could be either. I think it depends upon the particular situation. Here's one. In the case of a prospective research, so a survey, a discrete choice experiment, something like that, where data collection is ongoing. You have some data, but data collection is ongoing. Is it worth mentioning that's a preliminary cut of data and you're expecting a larger sample by the time of the conference? Yes, I think it is. One, because if I find the preliminary data interesting, but I know you're going to have more data that will lend more interest to it. Like I want to see how it's going to all turn out. We will note that it's preliminary data and that the conclusions might change. If let's say you're going to get 500 data observations and you only have 300 of them, like that will enter into the evaluation of it, and it might influence whether or not somebody says, okay, I'm only going to recommend this for more of a poster versus an oral presentation. But that's where you are at that point in time. And again, I think the argument here is say what you have and argue for why it's interesting, why it's useful for meeting the question that you've posed. So if research involved multiple stakeholders, would you put more weight to a particular set of stakeholders over others, and anticipating future impact size, for example, caregiver and care professionals versus care manager and payers, as presented in the research? I guess I will frame this. This is my personal opinion. Who's going to be at that conference, right? You're writing to the reviewers. Your research may ultimately be speaking to many other audiences, but you know who the audience is when you're writing this presentation abstract. It's the set of abstract reviewers for SMDM in that topic area domain, because we split people up by each of those 5 domains. That's who you're writing to. always keep them in mind in shaping your abstract. And that may mean that part of what you're going to say is, you know, say to them is this information will be really relevant to a different group, say a policymaker group or to care managers or whatever, but you're speaking to the reviewers, i.e. us, the researchers in this society, et cetera. Um, Volunteer abstract reviewers are asked to pick broad areas to review. However, within the area, there may be subject matter that we may not have expertise in. Does the review process allow us to abstain in an abstract review? Yes, you can abstain, and I see Matthias has said that. I will also say, if you take the lens that I am proposing, you probably can review it because you can figure out, did they pose a reasonable question? Um, did they actually answer that question? Are they presenting the relevant methods, et cetera? As a journal editor, I face this problem all the time. Like there are all kinds of papers that come into the journal that I am not an expert in the methods of. And what I've come to realize is that you can nonetheless be good at determining whether or not somebody is framing clear research questions, actually answering those questions, presenting the kinds of data that you need to evaluate it. And no, your review may not be as good as it might be something that's in your target area. But I agree with some of the people in the chat saying you're probably better than you think you are.
Um, I I was the one who sent in that question because the first I actually was an abstract reviewer more than a decade ago, and I was so intimidated by that process that I actually kind of said, I don't think I'm ever going to do this again because a lot of the stuff is way too technical. Because my background is really law, ethics, and policy. And I was looking at some things that was much more special because I think the law, ethics, and policy falls under a domain which also includes other stuff, which I don't have expertise in. So that's the reason why I always feel like it's not fair because because I'm also a member of the American Society of Bioethics and Humanities, and they allow us to exempt ourselves.
And if you need to exempt yourself, then you exempt yourself. Like if you truly don't think you can do a good job, and I do from time to time. Sometimes that's because we try very hard to ensure that abstracts are placed into the appropriate category, but occasionally that process goes wrong, and I end up with, a health economics analysis in the decision psychology pile of abstracts that I'm looking at. I'm like, this looks cool, but I have no idea if this is good, and I exempt myself from that and flag it appropriately. That said, I really do believe that the muscle of being a good abstract reviewer can be applied to things broader than your particular domain. We are all good audience members. And if I read an abstract, even if it's in a topic domain that is outside of my particular area of expertise, that's well written, I'm curious. I'm like, oh, that's an interesting question. Wow, I guess they found that, etc. And that itself is useful. And the degree to which it can be passed on in the review process is very helpful to people like Darren.
Thank you.
You're welcome. Ankur, your question. Conference abstracts allow for one figure or table uploaded as a figure. Any tips on how to optimize this feature? That's a good question. And having now seen a ton of these when publishing them in the journal, I have a lot of exposure of different choices that people make. I will answer the same way I think about this for journal articles, especially short journal articles. I think the best, whether it's a figure or a table, it depends. But you're aiming for something that makes your message, not presents the data. That's an important difference. Sometimes a simple, small figure that really shows whatever it is that you're trying to make the point about here is going to be way more powerful than a regression table or a pile of other statistics. I'm going to trust that I'll see the big table when we do the presentation. Right? I don't need that now. What I need is to see the reason why I care. And so, especially for things like showing effect sizes or comparative analyses where you really sort of getting a sense of this, no, really, this is a big thing, whatever that is, that's where I would tend to go. And I do think that you don't have to have a table or a figure in your abstract to score well. I think if you've written it well, you're making your point. And you only should be adding a figure or table to reinforce and amplify that point, not to add in extra data. Did I miss anybody? I think I got a lot of these. Um, I want to comment briefly on Scott's comment about methodologists and the way in which we focus on methods and results. It's not that I'm not focusing on methods and results. Like, there's a really important piece of, if you've posed a good question, there should immediately be a set of information I need to know. If you're telling me you're doing a survey of patients about radiologists, I need to know how many patients, where are they representative, etc. If you're doing a model and you're validating that model, what's the validation data, where did it come from, etc. Like, those methodological questions are absolutely critical for evaluating the quality of the abstract, but they're defined by the question. And that's the key thing here. It's not everything. It's what do I need to know whether or not you're doing a good job of answering this particular question. And so that's why I always start with what's the question, because there are times in which, I'm going to really emphasize certain aspects of the methods, and there's times in which I'm going to emphasize other aspects of the methods, and that's different based upon what point I'm making about that piece of research.
Brian, could we use the word lexicongraphical? Is that the right word? Where it's like conditional on having a good question, the methods are really important,
Yes.
right? But if you just have fancy methods without a compelling question, it like doesn't.
Yeah, I mean, I can know that you did good science and be bored out of my mind with your abstract. Just because you did good science doesn't get you a presentation. You have to have a good question, because there's all too much research done because nobody had ever done this. I would much rather go into a room and be posed with something that will evoke my curiosity. Go, ooh, that's an interesting question. Now I want to know more about it, as opposed to just hearing what somebody is doing. So that's why this sort of question answer framing, I think, is really important. Once you have that defined, it's a lexicographic decision making. Like, okay, given I've got a good question, that should make me essentially give me that checklist. I need to know this, this, and this. And it's going to be a different checklist for each research question. Yes. Any other stuff? Look, we got like 2 more minutes. I think if nothing else, I'm going to pass this over to Darren to make one last pitch for everybody signed up, everybody who is here to sign up. Now that I've taught you how to do good abstract reviews, please do them.
Thanks, Brian. I think I kind of was able to work my pitch in earlier. So again, please sign up and then please use that comment box to justify your scores, because that will help us when we have a lot of close calls and decisions on what gets poster and what gets oral. So thanks again, everyone. Thanks to Brian for a great presentation.
You're most welcome. I hope to see everybody in Oslo.